think we're good.
Yeah. So, who's running the recording this time?
I'll hit record on my voice memo again if that works.
Okay, perfect.
I got the recording.
Okay, cool. So yeah, I guess we can go ahead and start. And
All right.
yeah, well, I hope everybody's had a great week so far. How have you guys found the assignments? Pretty good.
Mm-hmm.
Yeah.
Good. Well, I know today we need to go ahead and define the problem as a whole. I know we spent a little time last time kind of discussing how best to address different issues that could be posed within the context of the problem itself. But now I guess we should kind of move into the idea of, defining the problem as a whole. So does anybody want to start out? Anybody have any ideas about that necessarily?
This was Scott. Are we going with mental health, right? Is that what we're the consensus?
Yeah.
It's just too broad, right? We just got to narrow it down.
Right. Yeah. So the whole notion of mental health. It has so many facets to it, and we had a really good brainstorming session last time, I thought. But yeah, I think we need to kind of discuss how best to kind of hone that into a more singular, streamlined area, so that we can kind of have those branches, more or less, those different topics that we talked about within mental health. So I think that would be kind of a good segue. Any thoughts, anyone so far?
What did you guys think of the compulsory commitment? I know we can kind of narrow that a little bit, and that was one of the things that I kind of liked about it. It's very narrow because, good Lord, with mental health, there's such a wide range of things that we can do. But I thought that this was kind of a very particular issue, comparing the differences between adult mental health and pediatric mental health, which through my personal experience learned that for the most part, a lot of systems put the one size fits all.
Right.
Yeah.
And I think if we could, address the problem, coming up with, okay, pediatric mental health patients need to be different. It needs to be more with parental involvement, because one of the things that we experienced with ours is that my son was taken from the house at around 9 o'clock at night, and I did not get a phone call from the provider until 1 o'clock the next afternoon.
Okay.
Right.
So, and I work at the hospital, and we know people, so we were able to have the right people to ask questions and say, hey, this can't be right.
Sure.
And so upon further review over the course of the next couple months, we worked with them, and they redesigned the policies and revised the policies and practices for pediatric mental health, especially when we're dealing with special needs kids.
Okay.
Kind of what I had, that was just something I thought that was narrow. But again, I'm open to, I'm kind of curious. I couldn't find too much on the Louisiana compulsory commitment law. I didn't dig too deep into it, but I'm sure the research I did say most states have one. And I just thought that kind of be something that we could examine and offer, ideas to improve it. Or, again, I'm not sure. Does anybody know what the mental health, that kind of process is like in Louisiana?
For compulsory commitment, or for specifically? Let me pull up the statute again. I read a little bit about it. Hang on one sec.
Yeah, the other thing too is if it's more information on a different state, we can just switch the states. If it's
right, and I think that's especially if we want to go broad, I think that's that's important to kind of keep it so that we can have that specificity, because it does allow for a little better leeway in what we're dealing with. It's in regard to Louisiana, my understanding of it is, it does take at least some sort of pseudo judiciary secondary to a medical examiner or a individual to be licensed or held in, I guess, basically to be held. It doesn't specify, as I'm kind of looking at the stuff on it. There can be judge interventions, there can be legal advocacies, but it doesn't specify too much explicitly about a pediatric violation versus that of an adult violation.
Yeah, and that's in Florida. It's not broken up.
Right.
It's just one law. It's called the Baker Act, and
Right.
in the mandatory 72-hour detention that's the same for kids.
Right.
And I think when we look at this, you can't it does not work to apply principles and practices that work for adults and for children at the same time. So I think I would just be curious of what it looks like in Louisiana.
Okay. I think that's a great jumping off point. I know that the position statement 22 is kind of the catch-all for that. We do deal within Title 28. That's kind of the catch-all substance. So, I think that might be a great way to kind of dive into that if we want to talk about, directing specificities to how we're actually going to, create a code of conduct or, statutory regulation for, pediatric offenders or pediatric, involuntary commitments, excuse me. So, I would advise that, again, we are kind of dealing with that Title 28. I think that's a great place to jump into it. Does anybody else have anything else on that?
I just have a question. It seems like, Scott, you might, since this directly affects you in a way, a lot of the stuff that you personally went through, is for the lead. I don't know too much about the topic. I just need to be pointed in a direction where to go to help with the situation.
One of the things that I think that really struck us that was this is you have law enforcement officers doing mental health assessments.
Okay.
On teenagers. And that was the first problematic area that we found. So I'm kind of curious if it's like that in the other states where you have sheriff's deputies responding to a complaint and they're the ones that are making these assessments. And that kind of is what spurred us into action, was because he should have never been taken away from our home. The police officers wouldn't listen to me when I was explaining to him. He takes multiple meds, and they wouldn't let him take his medicine with him. I had to write it all down, and he's probably got 7 or 8 different scripts that he takes daily. And so that's kind of the area that I'm looking at. And I don't know, maybe Florida's it's wackadoodle by itself. I don't know. But, I'm kind of curious kind of exploring, okay, what's the training that's provided to those that are making these referrals? Because in Florida, it can be law enforcement, it could be school teachers. When it comes to the kids, they can say, okay, they can call the sheriff's department and say this child is a threat to himself and others. And based just on that, then the law enforcement has the discretion to say, okay, we're going to put you under the Baker Act, and for the next 72 hours, you're locked up. So, I find it a fascinating topic, and again, in the spirit of full disclosure, my wife is a pediatric critical care nurse. So I've worked with pediatrics. I've been exposed to pediatrics, and being able to see, they're two separate entities. You can't apply practices that work towards adults with kids. And so, but anything, I would be willing, if you guys want to do this, I still have a lot of material left over from when we went through this. We ended up actually speaking with the director, the newly hired director of the pediatric psychiatry department at UF Health, and he sat and met with us for a good hour and a half. And a lot of the things that we put down, a good example was when we signed in to visit him, the names of every other person that had signed in were visible on the sign-in sheet. That was 19 HIPAA violations right there. So these are the things that we pointed out to them. They fixed, but they're still working from the legislative aspect to kind of get a separation between the way that you manage pediatric patients versus adult patients. So I am open to any kind of feedback, and if you guys have something better, hey, I'm all ears.
I'm definitely in for that. I mean, that's very interesting. I'm sorry that you even had to go through that, but it's interesting that you can bring like a personal experience to it, also a personal view, you know. So I'm definitely all for that. Do y'all know where we would find like that information relating to that for Louisiana? Like, does anybody know how to figure that out?
Yeah, so with that, there are a few different legal resources. Just the most general one that I would kind of look into. Google Scholars, always a great way to start. Kind of jump out that to give you just a general review of the literature. Moving from there, LexisNexis, LEXISNEXIS. LexisNexis is it's a legal scholarly database system that works pretty well. There's also Westlaw, WESLAW. Both of those tend to be pretty good about revealing statutes, and I can go through it with y'all how to navigate that and work through those systems if you have questions on it. But typically, you can just put in different cases. Criminal law information's pretty robust on that. In addition to different governmental regulations that are specific, and again, we do deal with Louisiana's nuanced legal system, so that has to be integrated. So again, it's not necessarily it's the Napoleonic law, so there will be some influence with that within the criminal law context. So that's just something to keep in mind if we do actually kind of write a more specified statute system, because it may not be exact with the same language or verbiage that's used in other states. But no, I mean, I think it's a really good jumping off place for sure. And again, I think as Scott said, jumping into the idea of doing this is great. I think a review of the literature and kind of if you could, Scott, if you'd be willing to disseminate that within the group, that'd be a really, really good jumping off point, because we can kind of get a comparing and contrasting of the different statements. Yeah, because I mean, I think that'd be a great way to do it. That said, we do need to kind of define word for word how we want to phrase the problem too, because I think that's pretty important.
Hey, Scott.
Yes.
I have a question. So, like, when all of that was going on, like, how long was your child, like how long were they in this program? Like, how long did this, like, go on?
Well, for us, it was 72 hours, because he'd already been under care of a psychiatrist for like 5 months. And basically what happened was that they had 2 suicides in his high school within 3 weeks of each other. And it's a very small school. Okay. So all the kids were doing that. So, but after that, we took care of it. And that brought up a great point. I'm glad you asked that question, is because, our son has an incredible amount of resources at his disposal. Mm-hmm. Okay. What about the kids that don't? And that's what
that's where it
was.
That's where my question was coming in, because if we're going to use this, then since the problem is one big problem, so like what my idea was like the funding of those programs, because when it comes to things like how that happened, there's always an excuse, like why it didn't happen the correct way. And I know, like, I had my sister before she passed, she had a mental disorder, she had muscular dystrophy, so like some of the same things happen, like kind of like what you're talking about. So, and even in Texas, I see it now, because I work next to a behavioral hospital, and I hear all these different stories about like different things that, there's no care after a certain time. Like, people can go and check themselves in as a grown-up, but like they'll pick up children late at night. Like it's just crazy things. So like I just want to know about the funding too. Maybe we can tie that in as well, because there's always something where you paying out of pocket. Like, how did this like?
That's actually a great point, because it's as far as the state of Florida is concerned, their only responsibility is to hold you for 72 hours to make sure you don't hurt yourself or other people. But
Cool.
There's no continuum of care, and that's what's scary.
That's what needs to happen, because 72 hours is never enough. It's just like a drug addict who's trying to come off of drugs. 72 hours will never be enough if their mind is telling them to keep doing that. Like, so I get that. So I mean, I guess that's something we can tie in, and that's easy to find stuff on. Like, you know, you give us like your feedback on like your information of what you went through, and then we can all pitch in and look, try to use those sites, and then just kind of look at random, like different sites that are like, of course, the LSU website, they have a lot of, I've been exploring on that. I can send y'all links if I look on there. There's been like a lot of different things besides EBSCO that I've been using, that I've been finding stuff like throughout this program. So maybe we can, you know, find different stories and different academic journals on stuff about that, because it's out there. It's just how we find it. But no, I just thought that would be a good question, because that way we can have more to talk about instead of like, that will tie in with that. Because like you said, every state is different. So yeah.
I just have a question. Should we take a vote? Do we want to just, since this is more of a personal thing, and I'm just foreshadowing down the line that we may actually have to really try to go to legislators and get this into policy. Since this is such a personal thing, should we take a vote and just, if we want to do Florida, since you have a lot of research and actual literature on this, Scott, what happened to you? So we can just start narrowing this down to...
That's sound.
Yeah, I'm fine with that. It's
So we can go so we can start answering questions like, do Florida? Because I mean, if you like Shay was saying, if you tell us what happened, like how she brought up funding, and we brought up no continuum of care, we can all take a point on one issue and then bring it all together. You know, like the Baker Act, what it says, and you know, for example, lack of training, like law enforcement, they're not trained for mental health. So if we all take an aspect of in Florida, and then we can bring it together, and you can, you know, kind of web it to what happened and why we want it changed.
To do that, if you guys wanted to do that, that's. I mean, I still have to go. I have to find it, but my wife is a prolific note taker.
Okay.
And when we were going through this whole process, we documented everything.
Okay, so maybe we should start answering some of these questions, right? The first one's easy. I seen Cyrus that you did the Google Docs for team number 3.
Yeah. This is Christy. I've been kind of adding stuff as we go.
Oh, okay.
Okay.
So we can kind of just...
Thank you, Christy.
Yeah.
Thank
I
you.
was up here like trying to write.
Yeah, me too. I'm trying to...
Everything Cyrus says, I kind of jot down, you know?
Okay.
So, I mean, a team name.
Yeah.
Anybody has an idea of a team name?
I got an idea to make it easy. The administrators, just open it. I mean, that's what we're healthcare, like it's like the Avengers, the administrators, like something simple. But I was Googling names and just trying to keep it. So it doesn't matter to me.
Hey, let me know what I.
Streamline and simple is great.
You're right, right? We good with that?
Yep.
I didn't hear it. It cut out.
The administrators?
The administrators?
Yeah.
Okay.
Maybe we can find like the Avengers like logo or like a plain one and put like the administrators like their logo or something.
Right.
I don't know. Maybe we can find it so she'll like get it. I don't know.
Yes. Yeah. Yeah.
But that's cool. If anybody opposed to that, anybody against it, not for it, like.
Any other ideas? Cool.
Any opposition?
All right.
Yeah. Okay.
Okay.
Okay, so I guess we got to decide on a state. So we want to do Florida.
I think Florida's a great way. Yeah, I think if the literature, we already have a preliminary kind of existing basis for that. That's probably easier, especially if we have personal and anecdotal stuff, we can kind of delve into that a little more because that does.
Yeah.
It's easy to work from specific and to work back rather than work forward.
And some of the stuff is across the board anyway, so
Right.
it'll
Exactly. And because, again, a lot of the civil and judiciary policies do apply a little more broadly from Florida to other states, we will be able to find a little more literature on that than doing Louisiana specifically. And it's nice not to have to work with the nuanced system, to be frank. So,
Okay,
Yeah.
so
I'm
problem.
just trying to find stuff online just while we're doing this, and I can't find anything in Louisiana without digging and digging
Right.
and digging.
it's,
You have to
Right.
dig.
I've
Me
found
too.
stuff, but it's a pain. I mean, you really got to go into it, and then
Yeah,
as
I don't really like Louisiana.
Yeah, very vague, Louisiana.
they have their own legal system, they have their own judiciary review, so they have their own stuff, and it's specific, and
Yeah,
it's
we're
not
south.
my wheelhouse. So yeah.
Let's just go with Florida. I
Yep.
definitely see that.
Okay, that's
Yeah.
easy enough.
Yep.
Yeah. Cool.
So for right now, I have the problem just listed as adolescent/pediatric compulsory commitment for mental health issues. So I'm not sure how much I want to narrow that down.
Well, I know she
Um,
said in that thing that she put, the video that she put out, that you shouldn't, what'd she say, you shouldn't state the answer and the problem or whatever.
Mhm.
So, I mean, at least that way you're not giving away what you're going to talk about. I mean,
Right.
you are, but without saying your solution. So that's all
Right.
right.
And then, of course, who is affected is our adolescent pediatric mental health patients. I have no clue for the next question how many are affected.
Well, so with that one, we would, and that's actually pretty easy to Google. We can probably just look that up right now.
Right.
It's a,
Well, Scott, you said earlier all high school, like for people who committed suicide, that's based, like when I was in Delaware, we had a high suicide rate too. I think we were like number 3 in the nation. So I would think all high school kids and under are affected by that, right? Because basically until you're an adult, they do whatever they want and then it's under parental advisory, right? Is that correct?
That's correct.
So
And
18
I
and
can-
under, 17 and under?
18 and under. I mean, I can Google real quick to see how, to kind of get one of the data points I'll look at is the number of, if I can find the number of pediatric patients that were put under the Baker Act per
Okay.
year. I
Oh,
know
okay.
and the whole thing that started this was suicides.
Mm-hmm.
And one of the things that really was stark to us is that these kids have been dealing and talking about suicide for 3 or 4 months. They lost 2 classmates within 3 weeks. And so when Nick would make the comment, I'm thinking about suicide. Well, with his brain condition, he's a very literal black and white person. He has been thinking about suicide. And because that's all they talked about. And I told the police officers, you need to ask him the question, do you want to die right now? And he would say, no, of course not. The kid's also a congenital heart patient. He's faced death most of his life, but he doesn't want to die. And that's what spurred this whole thing. So I can look at the numbers and compare the adults versus peds cases. I'm very interested in finding out too. I like the funding issue because I know some of these kids, they're Medicaid patients. So that's kind of another thing I want to look at because, our son, unfortunately, we have great health insurance. What about the kids that don't? And that's what's scary to me, especially with the number of suicides that we had last year. In our county alone, there were, I think the number was around 60 to 65 that they had in one year. And
What county are you in?
Alachua, around Gainesville, and it's mostly rural. You got UF, and that's about it. And so there are a lot of kids out there. So is there any other particular data points you want me to look up? Anybody have any other ones that they want me to look up?
I would look at I guess even mental health, forceful incarceration, associated with rural populations versus more developed areas. I think that would be a good statistic to have a variation because it kind of gives you an idea of the regulations and who's being compliant, who's being non-compliant.
Got it. Rural versus metropolitan. Okay. So I got number of adults, number of kids, rural versus metropolitan, mental health compulsory commitment.
Yep.
Okay.
So I guess for that data point, Scott, if you don't mind taking the lead on that, if you could just put that in the Google Doc for answering that, that would be phenomenal. If you don't mind.
No problem. I'll go ahead and take care of that.
Thank you. Go on.
Oh, I promise I won't be. I was late last week. I felt so bad because we
Oh,
got
no
crazy,
problem.
We got crazy busy Friday and Saturday, and I was like, oh crap.
Oh, yeah. We turned it in for 11. It was all good.
Okay.
Exactly. Sunday night when I get back
Christy,
home, I look and somebody else had already sent it in. So.
Completely fine.
And then what's crazy is sometimes Google Docs, you have to like go in and go back out and refresh it because it'll look like you're still the only person on there that's written anything. So I was like, wait, I turned mine in. Why is it not showing up? And then I shit. So
Yeah.
we look late. God, don't worry.
So are we just going to because it's, I mean, besides defining this into one sentence, we'll all put this on Google. Are we all just going to copy and paste this from Google Docs and upload it for our group assignment every week? That's basically the plan.
Only one of us has to submit it, right?
Right.
Okay.
So whoever is most tech savvy, I think if they're okay with that, that would be greatly appreciated.
Who submitted it last week?
Well, I was going to, but then by the time Sunday I checked it, it was already submitted.
Okay.
So I don't know who submitted it.
I'm gonna be honest with you guys. I submitted after I did the email, did the audio recording just to have something there. But I didn't know, like, do we all send it? Like, that's why I posted it into the group email, and then we all individually send it.
No, just one person has to upload.
Oh, okay. That's why I was sharing it in the email. Okay, I didn't know. Okay,
Yeah.
okay,
But it was there.
yeah.
Because I checked Saturday night and it wasn't complete. So when I checked Sunday night to submit it, somebody had already submitted it.
Yeah.
Okay. So the next question. I'm sorry.
I said I think this is a great topic though. So.
Oh, absolutely. Yeah.
Yes. So the next question is, why is there a problem? So I just kind of have, little notes: funding, access, processes. So I don't know exactly how we want to define.
I'm saying it seems like they have a lot of problems with this because a lot of people don't fully understand it and don't understand how to treat them, the treatment of care, and how to understand their problems. So I think understanding what's going on with them is first and foremost. And like we were saying earlier about the training, who is trained to deal with mental patients? How are they trained? And that's the biggest thing because you can't fix a problem if you don't understand the problem itself. So
I also think we could talk about facilities. I know in Louisiana, I don't know about Florida, but I know a couple of years ago in Louisiana, they shut down a lot of the mental health facilities because of funding. So if we could maybe find research on, like, are the facilities that these people are sent to, are they even equipped to give them the care that they need while they're there? And whatever Shay said earlier about, like, a 72 hours long enough to hold someone, that is sticking with me as well. So I think that's a great point to put in there also.
Absolutely.
So
like I said, that's probably something that's like literally not just Texas or like a Florida thing. It's that when it comes to mental health. So you guys, we probably could just see like what's going on each state and kind of like, because I know a lot of it in Texas, a lot of people in Louisiana, like, and then we have Florida. So we can just kind of like see if any of those things match and just go with that, because mental health across the board when it comes to funding is probably going to be about the same, like from that aspect that you said, Jordan.
Right.
So we can.
So literally, I
I think we could classify that as the continuum of care. Okay, once they're after that 72 hours, what's happening to those people? Are they being followed? Are they doing their follow-up care? And kind of explore from a policy standpoint, what can be done to ensure that people are still being treated. Also, I think it's particularly important with adolescents. And I think because a lot of kids, they don't have the support systems at home. There's a lot of different things that happen. So I think if we could explore, the continuum of care and put that as that phrase is kind of the catch-all phrase of making sure that post discharge after their 72 hours, what happens next. And that's, I think that might be a problem, because aren't we supposed to propose changes or what we can do?
Mm-hmm.
Okay.
Okay, so if we go lack of training and funding for adolescent mental health facilities, continuum of care.
I think that's a potential
I
exploration.
mean, then that's 3 topics in one. We can lack of training, the funding, and the continuum of care after 72 hours. And that should give us plenty of stuff to research.
Right, there's a lot of material on that, for sure. There's a lot of data and statistics and lit reviews that exist on that. So that's great. Yeah, I think those are really good topic points.
And we're not giving away what we're going to actually talk about. It's kind of
Right.
like broad, so that works. And then we'll have a lot of information to talk about. So
Okay.
Okay, so I kind of added little things to all these questions on our document, so y'all feel free to add, change, delete, whatever y'all want.
All right, I'm going to start typing right now. Okay.
Awesome.
Thank y'all for all the good work so far, by the way.
Yeah, you too. Thank y'all, everybody.
Oh, thank you.
And attendance, because I heard, like, one of my friends told me that, like, they used to have people in their groups before they graduated that didn't, like, people weren't showing up. This is like,
really?
I appreciate that. Everybody's on time. Everybody's here.
I'm in a hotel, but I'm here.
I'll do it. Yeah.
I am so protective of my GPA right now. I'm like, I've got this one, and then I'm doing the informatics next, and I want to keep that GPA where it's at. So
that's fair. I understand that.
Yeah.
Thank you all. This has been good. I will save this recording, and we are stopping now.